Yes, sir.
Okay, okay, thank you. Good morning, good afternoon, and good evening to one and all. Hearty welcome to TechNova 2.0, second day of this conference. In this conference, I want to highlight, okay, the future of nursing with an AI and digital healthcare, especially concentrating on the healthcare and also on the nurses, okay, how they are using it at in which places, okay, at where all, especially the use of robotics and future mental health, okay, and also in critical care settings. You know that one, since yesterday, okay, last day, we are talking about an AI in its different fields. Of course, Dr. Anugobai also has highlighted in different spheres, and also other people, okay, the speakers, and also in paper presenters. Of course, it isn't changing a lot, okay. AI, every fabric of life in the same field as in health also. AI integration, how the changes are occurring, if you see from traditional to an integration of an AI. Nowadays, we will say that when it is in smart hospital, using in telemedicine, and most of the things, okay, especially the vital parameters, okay, will be recorded by an variables, okay, and patient-centered care are reshaping healthcare delivery worldwide, okay. It is reforming it from the traditional ones, especially if you come to an nursing, okay, in the nursing profession. It is helping in early disease detection, okay, as in preventive measures, monitoring the vital signs and the other parameters, okay, like an biochemical and whatever we need it, okay, yet and applied to a nursing. Automated documentation, making as an the patient records, okay, then other records, medication safety, and predictive analytics and AI supported decision enhanced nursing care, okay. Very, very important, especially in an ICUs, okay, in the wards. Think that one of the patient is admitted, okay, what is his recovery rate, and also if he or she is admitted in ICU, okay, then what is the chances of getting in bed sore, okay. This will be having a very good assessment through a predictive nursing analytics, which helps you to care and see the future in early. So it is, of course, in overall, if you see this one, use of an AI is in reducing the administrative tasks, okay. Accuracy is more, it is very, very quick, and also it is helping for to provide an compassionate care. How we are utilizing? It's through IoTs, okay, Internet of Things, telemedicine platforms. So there are so many platforms are available. Then electronic health records, remote monitoring, and cloud systems to enable connected healthcare ecosystems. Okay, so it is having its impact on nursing also. Enhanced patient follow-up. Think that one. Earlier we used to go and we used to meet it, okay, through now the technology, okay, and with an apps, you can contact the doctor and you can do where you are there, okay. Then rural access, very, very important, especially if you see the in the COVID time, how it is an utilized it, okay. The health app reduced hospital load and continuous monitoring improve nursing effectiveness. For example, telemedicine significantly increased the healthcare accessibility during and after the COVID-19 pandemic, and also especially in psychiatric medicine. Okay, this telemedicine is a very, very important and playing an important role to connect, to diagnose, and to further follow up, and also in fund rehab and preventive aspects. So you're using clinical, intelligent clinical support systems, okay, which is an AI based, like in real-time ICU monitoring, predictive risk colors, smart triage. Okay, earlier you used to make it through an color codes, okay, but now you can use this smart triage app and you can decide it how you can care. Then early deterioration detection and faster intervention improves an outcomes. The main is patient safety is enhanced and mortality rates are reduced through an AI integration, because we will come to know with the efficiency and immediacy. Okay. And use of in robotics, and also in the future hospitals will be within robots. Okay, that AI hospital has already has an established in China, in very developed countries. Okay, in the forthcoming days here also in India, we can see that one how this AI hospitals will be built and the system will be built. Okay, in our Eudoxy also, we are having in planning to make it as an through AI, we can use an health resources, okay, for diagnosis and also for treatment. So robotic surgeries, automated medication delivery, elderly care robots, okay, especially those who are having an palliative care, okay, and in those who are for old age people, okay, to maintain their daily routines, okay. AI rehabilitation and smart wearables represent future nursing tools, okay. These all the things we have to adapt it, okay. So the main is, despite technology, empathy and emotional intelligence remain essential human qualities in nursing. You see this nursing profession, okay, when you are dealing with here, your touch, your empathy, your sympathy, your emotions will play a much more role than only the medications and other therapeutic measures, okay. So we have to follow an AI whenever you're using it in clinical settings and also in research related to health. Okay, so ethics, privacy, and human values forms the main concept of when you use an AI in nursing and health sciences. Okay, or in healthcare delivery. Ethical concerns, patient privacy, AI bias, and digital inequality and dependence on an automation and ethical responsibility are on ethical issues. Okay, so we have discussed a lot about how we have to use AI ethically, and it must be in a productive way. So first is it is used whenever is needed. Okay, and it must be useful for the patient as well as the nurses. Okay, so healthcare innovation must prioritize ethics, safety, and human-centered care. Nurses must protect human dignity while embracing technological advances, because it is not as such that on earlier days that we used to do. Now everything is in an automation. AI automation has come in an health care delivery system. On the time you have to embrace it. Okay, we have seen that on our honorable president sir also has developed an app for an health hospital for maintaining the bed, then for its patient allotment, diagnosis, rehab, and discharge. Okay, because we have to adapt it, we cannot control the research innovation. So we have to embrace it, especially if you see the mental health aspects. Okay, modern mental health care innovations like in counseling. Okay, AI tools are available. It is in counseling. Stress monitoring variables and digital wellness platforms support the care. Okay, it will help you to give an comprehensive and holistic care. So nurses provide emotional support, holistic care, and advocacy in community education. How? With the use of an AI tools. Okay, it's not as such that only AI tools will do. AI tool is always a tool. Okay, but the human touch is needed, and we have to imbibe it. Then we have to provide the care through this insight. So the main is digital healthcare should enhance, not diminish human connection. So what are the things we need it? Okay, as a nurses, okay, skills required for further healthcare professionals, we have to embrace AI. Okay, that we used to we have discussed with an honorable president sir and other speakers that somewhere we are because of too much concentration on AI, somewhere we are lacking it. No, we have to embrace. So we have to know that one how AI is used ethically and in a productive and holistic way for the betterment of the patient. So we have to have in digital literacy, AI awareness and critical thinking, data interpretation, telehealth communication, and ethical technology use are vital. That every nurse has to imbibe these skills and they have to adapt it. If we don't adapt, then we will lacking behind. So future nurses must blend technological skills with an compassionate care. Okay, this is one of the fundamental and vital function of a nurses is providing compassionate care. Okay, we need a human touch, and AI whatever the technology is there, and they are the supplement. It is an assisting us, but we are the one who are providing compassionate and holistic care. That we have to remember. So how we can practice it? We can go for virtual simulations, smart classrooms, AI assisted education, and online clinical training prepare nurses for future demands. Okay, with the technology of an AR and VR. The future AI-powered hospitals now already has an entered, okay, AI hospitals, personalized medicine. Now it's much more concentrating on the personalized medicine, predictive systems, okay, predictive medicine, predictive nursing, okay, and especially for diseases, okay, variable ecosystems. Nowadays, if you see that in the form of an wristwatches, okay, mobiles or in rings, okay, that it monitors all the things like in vital signs plus other parameters, okay. Then precision healthcare, very very important, and VR. Virtual reality in education are a very much emerging in nature, and so we have to adapt for it. We need an AI. Healthcare will become intelligent and connected and predictive. Okay, the forthcoming days, it's not only curative, it is becoming intelligent through the AI tools. Okay, it's an accurate in nature. Okay, precision. Then it is connected with others. It is not as such that only one, because we are viewing health in a holistic way. Okay, and it is in predictive in nature. So if you see an overall, AI is transforms healthcare globally. Nursing remains central. Technology boosts efficiency and safety, and compassion is irrepressible. Ethics are essential. Okay, even though we are saying that nurse robotics are there. Okay, but human touch is needed. Okay, it is transforming. Even though they are showing the symptom, emotional reactions. Okay, we need an humans. Okay, this is the main core. But the way you do it is in transforming. The future belongs to nurses empowered by intelligent technology. The future of healthcare is not built by technology alone. It is built by compassionate professionals empowered by innovation. Okay. The basic core aspect of a nursing is providing compassionate care. Okay. But this will be as an assisting for empowering it. Okay. It emphasizes the essential role of human compassion alongside with the technological progress. The future of healthcare, AI may power the system, but human compassion will always power healing. Okay, for in healing, you know that when people are in the stress, people are in the pain. Okay, of course, AI softwares will detect the pain. They will give an counseling, or they will help you to reduce it. But human is an irrepressible one. Okay, highlights the enduring importance of an empathy in an nursing care. That is the main aspect and core aspect of a nursing. So when you will see this one, we have now overall we have to embrace an AI, and we have to follow the basic concepts of a nursing. Then we have to provide it. Okay, thank you. Thanks a lot.
Thank you so much, sir, for your wonderful and brilliant presentation.